Have you ever struggled with carrying too much tension inside of your pelvic floor and not being clear, not really knowing how to release your pelvis? Or maybe you have been diagnosed with urge incontinence, which is like, I'm good, maybe I'm having a meal with my friends, or I'm working on something, and out of nowhere I get this urge, I have to go to the bathroom right now, otherwise something bad will happen. Well, today I have a really quick and extremely effective solution for you to actually introduce your pelvic floor to self-induced massage that is incredible tool for helping to relinquish control and actually invest more conscious relaxation inside of your pelvis. So right here we have a representation of a female pelvis, and if you look at the opening of vagina, you can imagine it as being a clock. So at the top I have number 12 and at the bottom I have number 6. And the reason I'm bringing that to your attention is that you will be working with your own hands really on the clock from 3 o'clock to 9 o'clock, meaning you want to stay away from creating a touch or a lot of like abrupt palpation in the northern hemisphere around 12 o'clock. So what you do, the best time to do it is in the evening or at night before you go to sleep. You lie down in the bed on your back and you put a couple of cushions or a couple of pillows behind the knees so your pelvis is neutral and you have a better access into your pelvic floor. Now you want to use a really good lubricant, and when I'm talking lubricant, I'm a big fan of not putting anything chemical, but looking after or working with organic lubricants. If you're not sure, you don't have access to anything, the safest option is going after like raw coconut oil. So you take a lot of raw coconut oil and you use, what works best for most women is using your index and middle finger to the outside of vaginal opening and your thumb to the inside of vaginal opening. So in a little bit of angle approach, you're not going straight, in a little bit of angle approach, you wedge your thumb to around the 3 o'clock to the inside, and your index and the middle finger are starting to create a little bit of circulation, palpation, motion to the walls of vagina, while the thumb is wedging itself to the underseam of vaginal opening. So your next options are staying still and just with the thumb investing, whether that is any tension or stiffness or maybe discomfort or even discomfort towards the touch. Then you are pressing or you're sort of moving this tissue away from the midline, and with the thumb you're also like creating this downward strokes or pressures that are so helpful for inducing blood flow and circulation, and also getting more conscious about the feelings and the sensation that really happening inside of the pelvic floor. From that place, you start to work yourself sort of millimeter by millimeter from that 3 o'clock down towards 6 o'clock and then all the way back towards 9 o'clock. As you're going through the sequence, you can also attempt to squeeze and contract, and in these different placements, you're looking for how much strength in these different segments do I actually have inside of my vaginal opening. And through the touch and through the consistent practice, you are recreating a foundation for more suppleness, more connection, and better relationship inside of your own pelvic floor. So this is my tip for today. Once again, I invite you to do this every single night before you go to sleep as a 10 minutes self-induced pelvic floor massage practice that will help to bring a lot of sensation, a lot of circulation, and a lot of relaxation in your pelvic floor, which of course means that from now on, you can focus on living your best life.